Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh.
Hello, everyone. I am going to be talking about I can't breathe. I can't breathe. Pneuma. It's the Greek word for breathing, air, and lungs. If you look at it from a theological standpoint, it is the spirit. Pneuma, the spirit, the soul. And we're going to be talking about how the exchange of oxygen in our lungs is so important, because if you don't have it, there's no exchange of air, you got a problem. And so we're going to look at a video because, I love to watch the videos and share. So we're going to do one today as an introduction about what is asthma. What is asthma? I can't breathe. I can't breathe. What is asthma? It's a terrible suffocation from the inside.
Asthma is a chronic lung disease that can cause breathing problems throughout someone's lifetime. When you have asthma, there is always a little swelling or inflammation inside the airways, with or without symptoms. Your lungs react to things that may not bother other people. These are known as triggers. Asthma can cause changes within the airway, all of which narrow the opening, making it difficult to breathe. A healthy airway is clear with no interior swelling, and the muscle bands around the airways are not tight. There is no extra mucus. Air moves freely through the open airway. When you have asthma, three main changes can happen in your lungs. If your asthma is left untreated or poorly controlled, changes to the structure of the airway may be permanent. One is swelling or inflammation. This is when the airway becomes swollen and irritated. When the airway becomes inflamed, it narrows, and it is hard for air to flow through. Another change that can occur with asthma is extra mucus production, which clogs the airway, making the opening even smaller. The third change that can happen with asthma is the tightening of the muscles that surround your airways, called bronchoconstriction. This reduces the opening even more. When someone with asthma comes in contact with an asthma trigger, such as dust, tobacco smoke, or even when laughing, any one or all three of the airway changes can happen. This is known as an asthma attack, or episode. All of these changes contribute to the narrowing of the airways, making it hard to breathe. Learn more at lung.org/asthma.
All right. So that was very interesting, and it's going to be very helpful for understanding what's going on for the rest of the talk. What you see is the reading of a normal spirometry. the reading of a normal spirometry. And that is a measurement of how much capacity your lung has, how much capacity that your lung has, how much air can you breathe in, how much air can you breathe out forcibly, and you can do it with relative ease because there's no constriction of the airway. This one is showing a normal reading of the lungs. Let's talk about what we're going to discuss today, and that's our introduction to asthma and allergies, causes and risk factors, the diagnostic and treatment types of treatments that we would use, some lifestyle changes, and then we'll just discuss a little bit of some of the recent research on biologics. So, introduction to asthma and allergies. There's, of course, medications, but there are inhalers. So, what is asthma? We just discussed it in our video here, and that is a chronic respiratory condition that's characterized by inflammation, narrowing of the airway, leading to difficulty in getting air through and exchanging it. There are three types of asthma. You could have allergic asthma, which is what we're going to be focused on. You can have exercise-induced asthma, and you can have occupational asthma. There's also actually cold-induced asthma. So you can have an asthma attack during the wintertime if you're standing outside and your airway starts to have spasms. You can have an asthma attack if you have asthma as an underlying condition. Asthma created by allergic asthma is triggered by allergens such as pollen, dust, pet dander, or certain foods. As we discussed, extreme cases is the anaphylaxis, and we talked about that last week. If you missed that episode last week, please go back and look at it. It may be very helpful for you to save a life. Overview of allergies. You want to understand that allergies affect the immune system. We've discussed this for the last 7 weeks, 8 weeks, that allergies affect your immune system. It makes it overreact to what would be a harmless substance to most, but it's a problem to those that overreact to these allergens. Common allergens we've discussed several times is pollen, dust, cat dander, dog dander, hamsters, cockroach dust, those type things, and certain foods. So what symptoms occur when you have these allergic reactions? Allergy symptoms that can cause mild to severe inflammation of the airway, will make you wheeze and have a squeaking noise when you're breathing, sounding like that type of hiss or wheeze sound, squeaky sound in the airway. Nasal congestion, where you'll sound congested, stuffy, as though you have a cold. You may not be sick or anything like that, but you would be so congested, and you will have drainage, which will make you cough a lot. And there's also digestive issues. These are some of the triggers and symptoms that can occur. Common symptoms and triggers With asthma, as we discussed, you will have wheezing. You can have shortness of breath, chest tightness, and persistent coughing. When I was working in my allergy clinic, I'd always pay attention if my nurse had given a shot and I was sitting in the office, but I would hear somebody clearing their throat a lot. And all of a sudden they start coughing and coughing more often. Then you have to be ready with an EpiPen because their airway may be getting tight. Allergy symptoms, we discussed sneezing, itching, skin rashes, respiratory discomfort, those type things. Common triggers, you should know them by now: pollen, dust, cat dander, dog dander, cockroach dust, feathers, those type things will cause these allergy and asthma symptoms. Genetics can be a problem. Genetic factors can be a problem if mom or dad have allergies or have problems. There's something called the allergic march. The allergic march. An allergic march is your baby may have been born with eczema, skin patches that are dry. Those dry skin patches are from allergies. Also, they would be congested a lot. Nasal congestion starts out clear, then can be colored, thick yellow or green in color. If they get sick or it sits there for a long enough time, those things you have to watch, because as they grow older, then it begins to affect not just their upper airway, but their lower airway. And they start to have asthma issues with the wheezing, short of breath, coughing a lot. Those are things that make the child a high risk. When you look at mom and dad, they may be high risk for allergies and asthma. So environmental factors, pollution exposure. This is what the point and purpose of the EPA was for, and that is to protect communities from factories that were polluting the air. You will find that in rural areas, it was less likely to occur from environmental pollution, but in urban areas, more minority children and poor income children were being affected by the pollutants in the air. So that would create a risk for asthma. Now, I normally don't get on people a lot, but I'm going to, for parents that smoke in the house, if you have a child that has asthma, for you to smoke in that house, it's really almost a form of neglect or abuse, because if you know that tobacco smoke would trigger an asthma attack, that's no different than you putting your hand over your baby's nose and mouth while they're sleeping. Now, I know that's drastic, but I just showed you a video about how inflammation occurs in the airway, which creates mucus and thickens the mucus. So if you swell the airway and fill the airway with thickened mucus, and that's triggered by your tobacco smoke, shame on you. If you're going to smoke and you can't stop and you just can't help it, go outside. God forbid you would smoke in the house and cause your child to have an asthma attack. Ridiculous. All right, enough on that. But allergens can trigger asthma attacks just as well as viral infections such as RSV, COVID, and any other upper respiratory infection. Some things you can do, lifestyle changes. You may want to talk with a nutritionist because they can help you with making a balanced diet for your child to help with their immune system. Exercise does help to an extent. You can't overdo it. You have to do it within capacity to strengthen your lung capacity and to expand it. Pet exposure, if you do it at an early age, it's better to have maybe a cat or a dog around your child when they're young, and that way their immune system can get used to it, as opposed to you taking your child to Aunt Gertrude's house who has 6 cats, and then your child has an asthma attack, which you didn't know they even had asthma, or they were allergic to pet dander. But when you're exposed that greatly and you have a non-affected immune system, or an immature, let's put it that way, an immature immune system, then you can have problems when they get exposed to a great amount of allergen. So what test can you do? What test can you use to diagnose or see if there's a problem? In the top left-hand corner, you'll see a peak flow meter. A peak flow meter. Peak flow meter involves using a peak flow to assess how well you can move air through the lungs. That is that little machine at the top. It's not really a machine, but apparatus at the top, where the green part is on the bottom. You put your mouth around that and blow. Blow as hard as you can. When you blow as hard as you can, you will see there's a red area, a yellow area, and a green area. The red area is usually less than 200. So if it gets up to 200 and that's about it, and you're an adult, you're having problems. If it's around 300, 350, the struggle is real, but it's not as bad as it is if you were in the red. Where you want to get is up to 400. At least 400 as an adult means you're doing fairly well if you have asthma. Even as a child, you should get to at least 350, 400. That's if you're around 10 years old. Little kids, it's a little more lenient. So you want to make sure that you're in that green area with that peak flow meter. Now, spirometry. Spirometry is done with the pulmonologist. This is a test that your doctor has to send you to a specialist, usually a pulmonologist. Some allergists do them. Some ear, nose, and throat personnel will do them, but it's rare that they will do it. Most times they leave that to the pulmonologist to do. And that will give you that type of reading, that spirometry reading. that we showed at the beginning. So spirometry is a common test used to measure your lung function and capacity, how much air you have and how fast you can blow it out or exhale. Now, the first one is blow out real hard. The second one, that has to be done with a pulmonologist, and it's blow, 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 blow. That's what they're going to have you do to get all the air out that you possibly can. That tells what the capacity is of your lung, if it's restricted or if it's obstructed. The bottom test we talked about when we first started this series. That's for allergy testing. And that is to test to see what are you allergic to, because that's going to be your trigger. For a person that has moderate to severe asthma, you need to know what you're allergic to, because part of that, you have to have an allergy test in order to have immunotherapy, because the test sets up your recipe for what's going to be in your shots. Now, medications, and we're getting close to wrapping up. Asthma medications, you have inhalers that are required most times to help you control your allergies and asthma. Short-acting allergy is in the top, or asthma. At the top right-hand corner is albuterol. Albuterol is a short-acting. Usually you can use that every 4 to 6 hours. If you're having to use that every 4 to 6 hours over a 3-4 day period, you need to see your doctor. There's a problem. Steroid inhalers are something that you would use daily. Those are used daily. And if you're in a severe problem, like you've got a cold or flu has hit you, RSV, something like that is affecting you, and you have asthma, you may have to have some oral steroids. And that's prednisone. Nebulizer, you'll see the woman there giving her child a nebulizer. Adults can use a nebulizer also. Biologics. Biologics helps with the inflammation that occurs in the airway. On a very cellular level, it affects and blocks you from having the inflammation that occurs. If you have asthma chronically, severely, these are excellent medications, and research is continuously happening. Dupixent is one of those medications. It's an injection that's given every 2 weeks. There is another medication, and it's called montelukast. Montelukast. Now, I want to give a warning to parents. I used to use it a lot. However, studies have been showing that it affects children in a negative way, causing behavioral problems and suicidal ideology or ideations. Suicidal ideations. So you want to be careful when using that medication. I would suggest that you talk with your doctor if you could use anything else besides that. I did want to make sure that you know montelukast or Singulair for children does have a warning now, which it didn't before, for behavioral problems causing anxiety and suicidal ideation. Allergy medications such as Claritin, Allegra, Zylol, Zyrtec, Benadryl, chlorpheniramine, Astapro, or azolastine. Those last two are nasal sprays. They are nasal sprays that are antihistamines. Those can be used to help to keep the upper airway from being inflamed. You can also use nasal steroids such as triamcinolone, Flonase, and Flonase. I discussed those two with you in Allergy for Nasal. Flonase tends to cause nosebleeds sometimes in the winter. And if you're noticing that or you're having headaches with it, you may want to switch to the Flonase Sensimist and see if that works better, or try triamcinolone or budesonide. Some things to help you for prevention and avoiding triggers is to reduce your asthma symptoms. You want to use humidifiers and air purifiers. Air purifiers tend to take out and filter your air. Humidifiers tend to put moisture in the air when it's a dry environment. When it's a very dry environment, like the wintertime, you may want to use that. But an air purifier, you can use that at all times. You want to identify your triggers by getting tested. And you want to make sure that you keep your house clean, keep old carpets cleaned. And if it's over 8 years old, you probably want to take that up. Hardwood floors, for most people, I know that's a difficult thing to do, but it may be an investment that you need to make. Between the air purifiers and hardwood floors, you may be helping yourself to prevent asthma attacks. So in conclusion, the importance of understanding asthma and allergies and how they affect one another is very important. You want to know what you're allergic to. You want to know what your lung capacity is with the peak flow meter. A simple peak flow meter, you can get that at a drugstore. I think the peak flow meter that I had in this video is like $11 or $12, at the most $14. There's ongoing research for different medications that can be helpful for asthma. Those biologics, they do work for moderate to severe asthma, but I need to let you know they're very expensive. It is hard to get them covered by your insurance, so you need to go through a pulmonologist to have that done. Sometimes ear, nose, and throat, ENT, otolaryngologist, they can prescribe it, but most of the time they have to do that, and they're not going to get it through unless you have nasal polyps. So those are little growths that will occur in the nose and make the airway restricted. Effective management and treatment can significantly help your quality of life with asthma. So you want to make sure that you're doing all that you possibly can. I have given you a lot of information quickly, and it was a lot to go back through, so you may need to watch this video more than once. Hopefully, your horizons have been enlightening.